So, it's not unknown that divorces and separations have increased quite a bit in the last few decades. I'm going to be using Spain as my main example. We have statistical proof that about 3.5 out of 1,000 people get married a year. On the other hand, the municipal databases show us that since 2016, it's about 2.2 out of 1,000 people get divorced or annulments every year. That's roughly over 60% when put into relationship between marriages and divorces. And Spain is not the only one following this trend. This is actually quite common nowadays to see it throughout developed Europe and in certain parts of America. This is why psychology is always looking for ways to improve treatment in the couples area. In this session, I'll be explaining the approach that has proven through various studies to be the most effective one, which is integrative behavioral cognitive therapy. Now, that's a very long title, so for the purposes of this presentation, I'm just going to refer to it as integrative therapy. But before I get into it, it's important to understand what couple problems means from the psychological perspective. Okay, so from a psychological perspective, we see couples' problem as the frustration of expectations and the recurrent discord that occurs within a relationship, understanding the couple as two married subjects or in courtship regardless of gender. It's considered problematic when the satisfaction from the relationship is no longer obtained and the intimacy and the quality of life of both subjects are affected, resulting maybe in depression, anxiety, and possible conflicts in both their social and work life. Now, from the integrative behavioral therapy standpoint, the problems of a couple can be understood as a result of the reiteration of unsuccessful efforts that each member carries out to face the inevitable and natural differences that emotionally affect one or both of the members. It's normal to expect differences in any couple because everybody is not the same. The problem, according to integrative therapy, is that we don't know how to deal with these problems and they then become incompatibilities. So, according to this therapy, we have deficient strategies to face these differences. We use coercion, vilification, and polarization. Now, coercion, along with its most popular technique, emotional blackmail, basically consists in the administration of an aversive stimulus that one of the member of the couple directs to the other until the latter agrees to their wishes. Now, the systematized application of this process can lead the member who receives it into a guilty state. It is, when this happens, in order to escape the feeling of guilt that the person can give in to the demands of the other. Now, explained from a traditional behavioral standpoint, the one who applies the aversive stimulus is positively reinforced and the one who receives it negatively. Although, it should be noted that the repeated exposure to this blackmail promotes habituation to it. In this case, it happens that blackmail loses its effectiveness, which basically means that the person has to either apply a stronger stimulus, aversive stimulus, or maybe more often, more continuous, in order to get the same kind of response. So this means that it's progressive, but it's not as effective, so sometimes it doesn't even work. It's also then applying a program of intermittent reinforcement when we see it from a traditional behavioral perspective. Likewise, it's usual for coercion to be met by more coercion from the partner, so usually this kind of coercive strategy generates certain patterns of interaction that undermine the integrity of the couple. Now, the next strategy is the vilification, which in simple terms is to blame the other member for the problems. Now, we use mainly three methods in order to blame our partner. We either say that the causes are psychological problems, maybe there's an evil nature of my partner is evil, he is bad, there's no good in them. Or the last one, personal incompetence. So we think that maybe something was lacking in them, maybe in their brain or in their upbringing or whatever reason, but they simply have this incompetence. And the last strategy is polarization, where each member of the couple begins to see themselves more and more distant from the other one and to position themselves more firmly in their own points of view. So the way that integrative therapy, is going to deal with couples' problem is focus mainly on one term called acceptance, which is what basically groups this therapy as a third generation therapy. Now, the difference with the classical therapy is that there's no intention of modifying the behavior of the other. Rather, in this therapy, we encourage change on oneself by modifying the context in which the couple's problem is occurring. From this approach, the present incompatibilities are accepted, understanding them as a part of the differences that make each person who they are, and discarding the idea that they are behind their difficulties, eliminating this idealization, what I believe that a person or relationship should be like, and more to start accepting how things really are. Now, throughout the therapy sessions, empathy is worked on by connecting with the other's personal history, understanding their vulnerabilities, their personal story, and seeing how they relate to the conflicts that are arising. The successful resolution of problems of this kind involves modifying the context in which the problem is involved instead of the specific behavior. Now, the main authors of this therapy, Jacobson and Christensen, say that acceptance could be considered the missing link in couples interventions. So I think it's important to know that Jacobson and Christensen were also involved in the traditional couples therapy, and this is more like a transformation of the previous one. However, according to them, acceptance should not be the goal of the therapy, but a means to find a common balance and an improvement in the intimacy of the couple. So, in order to tackle these problems that the couple is going to bring into therapy, we have the two main stages, obviously, the evaluation stage or phase, and then we have the intervention phase. So, for the evaluation phase, we're going to be gathering a lot of information through basically joint and individual clinical interviews and several questionnaires that the couple has to fill, and then we're going to review them in order to come to a few conclusions. And with this information, we're actually going to have a feedback session and explain the formulation of the case back to the couple. Now, this needs to be personal, it needs to be useful for the couple, and it should be used as a tool to facilitate their well-being. This formulation of the case has three main elements: the theme, polarization process, and the mutual trap. Now, the theme refers to the topics that are repeated in one way or another and that always cause problems even if they appear with different appearances. This means that the important thing is not the behavior that is happening, that is arising in the problem at home or at work or wherever with the couple, but what this behavior evokes, that is, its function. Thus, from this perspective, it is understood that different conflicting behaviors may have the same function and therefore the same theme. And this is exactly why we are not focusing on trying to solve behavioral problems from the beginning, but actually trying to know the core conflict and understand what is hiding behind all of these superficial pseudo problems or like wrong behaviors. The next one, the process of polarization, as I already mentioned before, refers to the pattern of destructive interaction that occurs before the appearance of the conflict on the subject. Is this extreme positioning myself in I'm right, things are this way, and it just makes me more distant from my partner. So what we're going to do is identify how they are polarizing each other. How are they standing far away from each other? Like, what is their standpoint, like their rigid belief system, and bring it back to them and deliver it back to them to make them aware that it's happening. And in that case, they can start dealing and not like stopping the polarization process right there, at least through the therapy process. In relation to the latter, the mutual trap, it's understood as the state or the feeling that everything is lost. So the mutual trap, usually it's the point where the couple comes to us and says there's nothing I can do, everything is lost, I don't understand where we're even trying, maybe it's just better to end things because there's no solution to this problem. And we're going to grab this feeling and validate it, and we're going to deliver back to the couple the fact that they're in therapy, that they're looking for help, as a like a shining light, like, okay, there's a light at the end of the tunnel, like there is an escape, there is a solution, because you still have energy, you still have desire, and you're putting in the effort. So it's just kind of like a tool that we as therapists are going to use to kind of bring a little bit of confidence in the process back to the couple. Now, in relation to the intervention, once we've already made the feedback session and we've explained everything, then we can start working with a couple. In this case, the way that it looks is very typical. You're going to have sessions. They can be weekly or every 2 weeks. It's going to be with both people from the relationship. We're not going to do any individual sessions. It's usually recommended to have around 26 sessions. That would be like give or take a few. And it's going to be based in 3 central strategies: empathetic union, the unified separation, and tolerance. Now, the first 2 are acceptance strategies, and the last one, tolerance, it's more like a emergency strategy when you cannot do the first 2. So, the empathetic union, the objective of this is to try to diminish the negative behavior of the couple. For this, clients are asked to express the pain caused by these behaviors without making an accusation and without blaming, only showing the spouse or the partner the emotions that their behavior have caused in them. So, this is looking for compassion, this is looking for the empathy of the partner, just to explain like how they are being affected. In the next one, unified separation, well, through this intervention, we work with a couple to understand the interactions of the marriage, which lead to feelings of frustration. It's about the clients observing the problems from other perspectives and making an intellectual analysis and not emotional one, and pretending, like acting as if they were speaking of it as something external. Like imagining that is somebody else has the problem, or even as the problem as a third person. But definitely kind of creating like this separation between them and the problem, so that they can see it more rationally and not too emotionally. And when the couple is too polarized, then these ones are a little bit difficult to apply. We start first with tolerance strategies. Now, as I said, we only start through tolerance when the previous techniques don't work. Through this, the therapist will help the couple to create tolerance between them and to solve conflict more quickly. Some behaviors should not be tolerated or accepted, though. For example, we're not going to work tolerance with domestic violence, and we're not going to work tolerance with abuse or drinking problems, drug use, and such. Now, for the tolerance, we have a few strategies. We use the role playing of negative behaviors during session. So in session, the couple has to act out a typical problem interaction, and then we're going to do it over and over and over again in session until it's no longer as painful as it used to be. So we're increasing the tolerance to the same kind of stimulus. The other one is the imitation of negative behaviors at home. And this one is very interesting because let's say that you have 2 people, Mary and Joe. Joe knows that when he gets angry, he acts a certain way. So what he's going to do is, without telling Mary, at home, he's going to act the same way as he would when he's angry, but without actually being angry, just to be able to observe Mary's reactions without having like the rage blindness or like the emotional impact on him. And Maria is going to do the same thing. And this is basically to recreate their behaviors without the emotional investment, so they can start like identifying like the differences, like my actions, my feelings, the reactions, and so on. And the last one is skills of self-care. And with what is sought to find alternative means to cover your own needs and not wait for the couple to supplement them. So through the process, maybe if you're too polarized, you're not really going to get a satisfying result right off the bat. So in this case, what we do is we try to teach each person in the couple self-care skills, so that they can supply their own needs by themselves until either the couple does it, or if they never do it, then they at least have a new skill. Okay, and since, like I mentioned before, this therapy is more like a transformation or evolution of the traditional behavioral couples therapy. That means that the original behavioral techniques have not been eliminated. They're still like the traditional ones, which would be behavioral exchange and communication and problem solving skills. So the first of these intervention strategy focuses on promoting the exchange of positive behaviors in order to increase satisfaction with the relationship. But it's basically tasks based on rules for home, for social outings, and just like rules for interaction between the couple in order to generate positive changes in the natural environment throughout the establishment of behaviors governed by rules. And the second one that I mentioned of strategies is aimed at obtaining relevant skills to successfully resolve conflicts, teaching the couple communication skills and problem solving skills so that they can solve their own conflict or conflictive situation by themselves. Also, to train them in communication that is not accusative, communication that is not aggressive. So basically increasing assertive communication. Now, but it's important to know that we're not usually going to start through behavioral strategies. This therapy is based, or like the theoretical basis of this therapy makes a strong point on starting with the acceptance strategies, and when these are difficult, then to start by tolerance. But we will never start by the behavioral strategies. We will use them as an extra to improve the acceptance strategies and just like the interaction between the couple in therapy. And with the tolerance and acceptance strategy, we might start by tolerance, but the tolerance is going to help us start later on with the acceptance, which then will improve the tolerance as well. So it all kind of goes back to acceptance being the main pillar of the therapy. And that would be it. Does anybody have any questions?